Welcome everyone to today's webinar. I am Ayla Ellison with Becker's Healthcare. Thank you for joining us for today's webinar, Maximizing Reimbursements, Improving Your Revenue in 2019, sponsored by CollectRx. Our webinar today will be about 30 minutes. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. Additionally, in about a week following the webinar, we will be sending you a copy of the presentation to the email you used to register. At this time, it is now my pleasure to start today's webinar by introducing our presenters. John Bardis serves as CollectRx's Chief Executive Officer. Mr. Bardis is a veteran in the field of healthcare and information technology. As president of Dr. First Incorporated and Executive Vice President of Prematics Incorporated, Mr. Bardis has specialized in providing cost containment services to health insurers and various products and services to hospitals, health systems, and other healthcare providers. Previously, Mr. Bardis was an attorney at Kirkpatrick & Lockhart, now K&L Gates, where his practice focused on litigation. Mr. Bardis's clients have included a wide range of for-profit and not-for-profit health insurers, including Blue Cross Blue Shield of Florida, Humana, Capital Blue Cross, Kaiser Permanente of the Mid-Atlantic region, CareFirst, and Blue Cross Blue Shield of Massachusetts. Mr. Bardis has also worked on behalf of numerous hospitals and health systems, including Henry Ford Health System and MedStar Health, along with hundreds of physician practices. Richa Singh is Executive Vice President of CollectRx. She brings 10 years of revenue cycle experience to her role at CollectRx. In this role, she has focused on enhancing out-of-network reimbursements to ASCs, physicians, hospitals, labs, and behavioral health centers. She specifically played a key role in the growth of the firm, which now has a client base of more than 800 U.S. providers. John, I'll now turn the floor over to you.
Thank you, Ayla. I appreciate it. And hello, everyone. I'm John Bardis. I'm CEO of CollectRx. I'm pleased to be here today. I am joined here by Richa Singh, our Executive Vice President. And we're going to be talking today about how you can maximize your reimbursements by improving your revenue in 2019 and the role that out-of-network plays in that strategy. Richa?
All right, thanks, John. So for today's discussion, we're going to start with a background on CollectRx and our out-of-network expertise, so that way you understand why we're in a position to discuss this. Then we'll talk about the market at large and what's driving out-of-network. We'll discuss the current out-of-network trends, and we'll also compare the trends in how an out-of-network bill is different from in-network ones. Also, what you need to do to ensure that you get paid fairly on out-of-network. And lastly, we're going to walk you through building an out-of-network plan that will work for you. So our goal today, when we're done, is to provide you with all the information you need to build your out-of-network strategy for 2019 and also familiarize you with some of the intricacies that are required to successfully run an out-of-network operation. So despite our name, CollectRx, we are not a collections agency. We have nothing to do with the pharmaceutical industry. But what we do here at CollectRx is we help providers get higher reimbursements on out-of-network bills. We don't do this as consultants, but as experts in negotiating reimbursements on out-of-network bills. So you can think of us as your prescription for higher out-of-network payments. Now, CollectRx, we are the only company in the country that's focused on helping providers get higher reimbursements on out-of-network, and we've been doing this since 2006. We work with over 800 customers nationwide, and we work with a variety of provider types. So this includes surgery centers, physician practices, hospitals, substance abuse centers, and labs. We process over $1 billion in claims, out-of-network claims every year. So we've encountered a lot of different out-of-network scenarios. And we've built a very unique team of out-of-network experts who used to work for the payers and their vendors. This puts us in a unique position to understand the payer's soft spots and get higher payments on out-of-network bills for our customers. Now, another reason for our success, a huge reason, is what we call our CRIXIS Business Intelligence Engine. CRIXIS stands for the CollectRx Information System, and it's a data and analytics tool that we've created to counteract the payer's efforts to reduce payments on out-of-network bills. So it allows us to do a lot of different things, but some of the highlights are that it analyzes actual insurance policies throughout the country to determine what's usual and customary. It also provides us with an incredible amount of comparable data because we're aggregating the data and results from the 800 plus customers that we service, and we use all of that data to compare our determination of usual and customary with what the payers come up with. So in many cases, we're able to identify holes in their data and convince the payer to increase their payments. And the final point I want to bring up with Crixus is that it also captures the business intelligence about the tendencies and trends of the people on the payer side that we're negotiating against. So our experienced team knows who to speak with at each of these companies, and they have the ability to go to senior personnel at the payer, who oftentimes are the only ones with the authority to approve higher payments to providers. So that's a little background on CollectRx. Now let me turn it over to John to talk more about the market.
Thank you, Richa. So when you think about planning for 2019 revenue optimization, it's imperative to start by examining the trends that are affecting the market at the moment. Healthcare in general and payers in particular are evolving quickly, and when you're looking at your revenue sources, it's necessary to understand the trends and changes in the bigger marketplace that may be impacting what's going on with your strategy. It may show you great opportunities, or conversely, it might help you to decide a different direction. So today, I'm going to be reviewing sort of three big ideas. First, what we call macro trends, or big ideas that will have a longer-term impact on the ability of providers to optimize revenue. Second, the trends that are specific to the out-of-network market. And of course, to give you a hint, we're pretty bullish on it. And then finally, we'll give you a refresher on narrow networks and how they can be leveraged to your advantage. There was a lot happening in the insurance market in 2018, but the overarching theme for payers was continued efforts focused on lowering healthcare costs so long as the quality of care was not sacrificed. It's anticipated that much of their cost cutting will occur with their contracted providers, so establishing a robust non-contracted strategy will be critical as you build your revenue plan for next year. Insurance companies have created policies, designed plans, and narrowed provider networks to bring down healthcare costs. Building on this success, we expect payers to accelerate those programs and policies and search for more cost-cutting levers, including pushing services outside of hospitals. In an effort to move towards value-based care, payers may move into bundled payments, bonus payments, and capitation as it pushes providers to care for the whole patient rather than just receiving payments for individual services. The shift towards cost-effective places of service will require payers to align provider incentives to get the best outcomes. It also gives providers greater flexibility to choose the right care for their patients. Payers will continue to develop payment models that encourage patients to find care in the most cost-effective settings and use those services efficiently. Payers have been pushing for more patients in outpatient facilities as a way to cut costs. Care delivery is moving out of the acute care setting and into the community. Such a trend is responsive to consumer demands for fast, transparent, convenient access, and offers the potential for higher volume and lower cost in specialized clinic settings. We're also seeing more payers get more involved with the payer side and vice versa for that matter. Increasingly, providers and payers are more concerned about managing patients' health rather than viewing them as just volume. We will see more experiments and partnerships along these lines as the lines in healthcare continue to blur. For out-of-network providers and facilities, understanding how your in-network reimbursements will be impacted by these trends is an important part of your planning for next year. While the tightening of in-network patients, coupled with the abundant opportunity for outpatient and non-hospital revenues, early planning will be a key for maximizing 2019. As this relates to surgery centers, the general consensus points to significant growth in this provider segment. Across the board, there's a strong current that points towards growth in the number of facilities, the types of procedures, and the volume of procedures that are being performed. You can see a full list on this slide, and thanks to the folks at Becker's who have put this kind of work together. But generally, we are seeing a growth in outpatient surgeries across some of the largest specialties, including orthopedics, spine, GI, gynecology, and ophthalmology. Switching gears, let's talk about how out-of-network reimbursements are working specifically. Now, as Richa reviewed, CollectRx is an expert in the reimbursement of out-of-network claims, and from our vantage point, we see continued growth due to market factors specific to out-of-network and the way the healthcare system is evolving. Out-of-network isn't going away, and there are several reasons why. The first key point here relating to out-of-network is the total number of insureds that has risen substantially. It's our view that with the implementation of the Affordable Care Act, that the number of insureds with the out-of-network benefits has risen. Let me talk about the reasons why. The number of individuals who picked a health insurance plan from the ACA marketplace is over 10 million and frankly probably closer to 20 million at this point. While not all plans are friendly towards out-of-network care, a portion of them that sign up will have out-of-network benefits. Since most of the 10 million plus providers signing up were not previously insured, by simple math, this will increase the number of insureds that have out-of-network care. So what do we think of when we think of the ACA enrollment process? Well, for one thing, as the 10 million plus people with insurance that were uninsured previously, what are their characteristics? Well, typically a relatively sick portion of the population that tends to be in lower income and stands largely outside traditional employer-based commercial insurance. What is important to note is that it's not only the number of patients that are now covered by insurance, but it's the categories that show more towards open plans that include out-of-network benefits, that those have risen. A second reason that out-of-network will continue to be an important part of the market is the sustained growth in PPO enrollment over the years. So what plans are people choosing? Well, we continue to see popularity in the broader choice PPO plans. The number of PPO enrollees, it grew by 4.4% from 2014 to 2016, demonstrating that they remain a popular choice. And the majority of employer-sponsored health plan enrollees choose either PPOs or high-deductible health plans. Most out-of-network bills come from PPO members, and since the early 2000s, PPO enrollment has more than doubled. Statistics show that 10 to 20% of PPO members will have an out-of-network experience each year. And the out-of-network benefits for large employers is mirroring smaller employers, which means that 2/3 of those insureds will have out-of-network coverage. And what about the composition of these plans? 2/3 of the plans in the small group and almost 1/3 of those for individuals include out-of-network benefits. And there are these are new net adds to the insurance pool, which increases the total number of those who have out-of-network benefits. Now, so with respect to out-of-network, it's difficult to see how any of this is negative, while the emphasis on narrow networks, along with driving patients to a more commercial insurance, we're seeing a positive impact on out-of-network. Now let's talk for a moment about what we're seeing with respect to limited benefit policies. Sometimes we hear providers complain about such policies, and for a couple of reasons we think that's a bit misplaced. Now, by a definition here, a limited benefit policy is a policy that puts restrictions on the calculation of reimbursement. The United Healthcare M&RP policy, the Cigna MRC policy are examples of such policies. The prevalence of these policies vary by marketplace, but on a nationwide basis, they're still not dominant. So to examine this, we decided to look at our data to see how often we handle cases with limited benefit policies. And using Crixus, which Richa described before, our data and analytics tool, we looked at cases involving two of the largest payers. We found that the large majority of cases we handle at CollectRx are not limited benefit policies. Rather, the majority of bills involve standard, reasonable, and customary reimbursements. Perhaps the most important driver of policies with out-of-network benefits is patient choice. People want insurance policies with out-of-network benefits, and they are willing to pay for insurance policies that have out-of-network benefits. Again and again, we're seeing evidence that patients want those benefits. Here's another example of that. So not only is doctor preference driving it, but also there are more specific needs such as emergencies, specialized care, out-of-town care, and proximity issues. So why is all this important? Well, we know that more patients are selecting plans with out-of-network benefits, but do they use them? There's a survey by Software Advice that helps us understand this trend. They found that 82% of patients surveyed consult a review website with some frequency to view the post comments and to view the ratings of healthcare staff. Of those, 48% were willing to go out of network to a more highly reviewed doctor. And they use these tools when they are searching for their providers, which means that out-of-network services are not just an accommodation for existing patients. Candidly, these patients are looking for you. Now, additionally, the prevalence of out-of-network claims has been growing. Estimates are that the market is $60 billion and growing still. Simply put, it's just not going away, so you need to learn how to use it to your advantage. Providing a couple examples here of the where we see out-of-network, 27% rather of all inpatient admissions with an ED claim were from out-of-network providers. In 2016, a third of all inpatient health services, mental health services, were billed by out-of-network providers. 20% of inpatient surgical services and almost 19% of inpatient medical services were also billed by out-of-network providers or facilities. And then finally, what we're seeing in the marketplace is reflected in an extremely robust trend towards out-of-network with our own clients. The volume and dollar value of claims that we're seeing from our customers has risen sharply over the past 5 years, as has our success rate. So let me wrap this up with a quick word or two about the situation around narrow networks. Starting with the definition, what are narrow networks? Well, narrow networks place limits on insureds by charging higher patient responsibility for care provided outside the network. Payers are increasingly offering narrow network policies, particularly within the ACA exchanges. The reason? Because narrowing the network allows the payer to offer lower premiums at only less expensive providers are being allowed into the network. In other words, there are fewer providers in narrow networks. The one big downside stemming from narrow networks for patients is choice, or lack thereof. However, for the most part, the plans don't prevent patients from seeing these providers. So as such, these narrow networks will result in there being more out-of-network care. And it's not small, lesser-known providers who are being impacted. In some markets, large prestigious hospitals or health systems are being left out of narrow networks. The result? Again, simply by definition, you'll have fewer providers that are in-network, making it even more important to be able to handle out-of-network issues handily. So in some, narrow networks, by definition, they result in there being fewer in-network providers. As such, narrow networks lead to more out-of-network providers. So whether you want to or not, you need to be good at handling out-of-network billing. So let me turn it back over to Richa to talk about specifics of your plan.
All right, thanks, John. I want to start by talking about why it's important to understand how a claim is processed. So far with John, you've heard the data and you know out-of-network makes sense for your practice, but what now? So first, let's make sure that we all understand how an out-of-network episode differs from an in-network one. Now, the revenue cycle process for out-of-network is very similar to that of in-network. But what you'll see is that the biggest difference is it lies in timing and the mission-critical nature of the tasks that need to occur. So the first major differentiator between how in and out-of-network bills are processed is around verification of benefits. Contrary to in-network, out-of-network benefit verification should occur before patient scheduling because it's essential that you understand the reimbursements you'll receive for that patient to ensure you cover costs. Now, the second difference is reconciliation. You need to have a meticulous reconciliation process where time, staffing, and technology are all required. It's incredibly important to take a look at each out-of-network payment to determine if you need to appeal a claim. For your successful appeals, have they been processed correctly? And then also, you just need to simply make sure that money's in the bank. And the third and largest difference for in and out-of-network processing is around optimizing your out-of-network negotiations and appeals. So this is a foreign concept to in-network providers because in-network claims, they're supposed to pay per the managed care contract you negotiated. But with almost every out-of-network claim, you need to take the extra step of negotiating or appealing it because payers use a variety of tactics to reduce your reimbursements when you're out-of-network. But with proper data, resources, expertise, and of course persistence, you can make much more money than being in-network. So now, developing a level of expertise in out-of-network negotiations and appeals will go a long way towards ensuring the success of your out-of-network program. So I want to go through the basic process of an out-of-network bill. So start with me at the top of this slide, and first off, obviously, you provide service to the patient who's out-of-network. You generate a bill that's sent to the payer, and then they send it to one of their vendors that handles these bills. Now, the vendor, they look at their databases and they determine based on a number of factors like the size of the bill, the type of service performed, past experience with you, but the most important factor is employer preference. Then they decide which of the two strategies at the bottom of this slide would yield the lowest possible payment to you. So one strategy going to the left-hand side is for the payer or the vendor to reach out to you prior to payment to negotiate a settlement on that bill. But going to the right-hand side, that's the other strategy, and it's for the payer to reprice the bill down to what they consider to be usual and customary, or even deny your bill. Okay, so now let's switch gears and discuss how to practically build your 2019 revenue plan to include out-of-network. And to give you a sense of the out-of-network opportunity, let's suppose, hypothetically, that you produce $5 million in revenue. Now, of that revenue, 15% of it's coming from out-of-network patients, and you operate at a 20% margin. If you were able to increase the allowable amount by CollectRx's standard 33%, then the result would be a $250,000 incremental reimbursement in profit. If you're operating at 20% margins, that $250,000 in additional reimbursement would translate into $1.2 million of additional revenue at your current margins. Another way to look at this is to translate it into in-network payment terms. If you're contracted with a payer who represents a small amount of your business, it would be like them coming to you out of the blue and saying, hey, we're going to improve your reimbursement rates by 33%. So this is exactly the power that exists for providers with the out-of-network opportunity. So let's start by reviewing tangible ideas that you can do to get started. So it does start with leveraging best practices in out-of-network. from understanding how you've done with prior out-of-network claims, to analyzing your fee schedule and chargemaster, to establishing and validating your current processes. So there are some key things that you can do prior to 2019. And it starts with the first step here, first best practice here, is an out-of-network case review or audit. This will tell you a lot about your out-of-network history, what you've charged, what the payers have reimbursed at, and you also get a good idea of the money that you've left on the table and what's potentially still appealable for an additional profit. The second best practice is to analyze the success you've had with out-of-network. Look at what you've billed and what the payers have reimbursed across your procedures. Have your previous negotiating efforts been successful? And if not, why not? I'm sure that one of our past webinars can address that issue for you. The third best practice is to analyze your fee schedule. When you do so, there are three major areas that must be evaluated. It's overall cost, it's your current fees and payments, and a usual and customary database. Then compare it to the payments that you're receiving for each of your payers by CPT code to see if you are sufficiently compensated. Next review is the chargemaster review, the fourth best practice. So you'll start off with performing a complete CDM review to establish a baseline indicator as compared to best practice benchmarks. Then analyze revenue and usage to identify potentially missing charges. You will minimize compliance risk by reviewing charge descriptions against CPT codes and reviewing all compliance that is flagged. And then finally, identify revenue opportunities that are appropriate for in and out-of-network claims. The fifth best practice here is validating your reconciliation. So as you begin to understand your out-of-network billing and reimbursement history, you'll want to continue the analysis to fully understand what has been billed and paid by the payer. If there are holes in your process, then you'll want to fix them now before introducing multiple payments for the same claim to your workflow. Missing payments, they can be a significant inhibitor to success in any out-of-network program. The sixth best practice for 2019 planning is a workflow and process review. Take a look at your current processes and ensure that they're strong, because defining your workflow and processes will help you identify any gaps and evaluate if you're positioned to capitalize on out-of-network with its more complex verification, negotiations, appeals, and reconciliation processes. And finally, the seventh best practice is third-party rental network agreements or silent PPOs. Now, to clarify, these are contracts that are not made directly between you and a payer, but it's between you and a third-party company that works for the payer to save them money. Although these contracts are sold to you to help save you time, they are actually detrimental. These contracts, they serve as caps to your out-of-network reimbursements and will only be applied when it saves the payer money. They also include language that calls for cuts that are in addition to your discount, making this another reason why reconciliation is so important. You need to understand if you're getting reimbursed for your third-party contract, because most of the time providers just aren't. All right, so quickly I want to discuss building your out-of-network plan. Since out-of-network reimbursements have substantial opportunity to pay higher than in-network, you might be considering going 100% out-of-network, but often a hybrid strategy is going to be the best way to position yourself to maximize revenue. CollectorX generally recommends a strategy in which the provider goes in-network with some payers and stays out-of-network with other payers, based on the step lines that I'm about to address. So first off, conduct a comparative analysis of the reimbursement levels between in-network and out-of-network for your biggest payers. So to do this, you do not need to boil the ocean. Rather, select a handful of your most common procedures, do a side-by-side comparison of what their reimbursement levels would be, and then you'll want to compile prior receipts from the procedure, project the number of cases from that procedure, and then multiply that by the average reimbursement level. Then just flip the page and conduct the same analysis for out-of-network for that procedure. And continue the analysis through your top procedures and payers, and you'll be able to determine with whom you're better being in-network and with whom you're better being out-of-network. Now, once you've completed that analysis, then it's time to dip your toes in the water. However, if you've been in network for a number of years, you might not be familiar with the various parameters and requirements that apply to out-of-network. So because of this, we do not recommend canceling all your contracts today and going 100% out-of-network, but rather take a more conservative approach based on your analysis. If you have a relatively smaller payer that appears to have a more attractive out-of-network revenue profile, go out-of-network with the payer for 4 to 6 months, see how your reimbursements are doing, implement the out-of-network best practices that we discussed, and then make the decision whether it makes sense to expand and add another toe to the water or just to hold off. But finally, let's face it, as providers survey the landscape today, there just aren't many opportunities to improve reimbursements. In network contracts, they are what they are. There's limited, if any, opportunity to increase those rates. And with respect to Medicare and Medicaid reimbursements, there is no opportunity to change those rates. But leveraging out-of-network reimbursements, it really represents a last great opportunity for many providers to bring more dollars in the door to improve your bottom line. So in summary, we hope that we have helped you with some ideas to maximize reimbursements in 2019 and have familiarized you with some of the intricacies required to successfully run an out-of-network operation. We want to thank you all for your time. I hope you found this session useful. I know we're a little bit over, but can we get a couple of questions?
Yeah, thank you, John and Rita, for that fantastic presentation. We are going to go ahead and work through a few of the questions that came in. It looks like we've had several come in, so we'll just go ahead and get started with those now. So the first question is, do you think entering into global agreements used by the pricing vendors should be part of my strategy?
I'll take this one, John. So we're on the same page. The global agreements, they're basically a lighter version of the third-party rental agreements that I was talking about during the best practices. And they basically suffer from the same issues. I mean, there's caps to the contract. They have, additional cuts than just the discount that's on your agreement. But most importantly, it locks you into low rates for reasons that, a lot of providers just don't understand. So, feel free to reach out to us after the webinar. We can definitely discuss that further.
Thank you so much, Richa. And the next question that came in today was, this person wants to know, do you have any tips for negotiating in-network contracts?
Well, just off the top of my head, I think there are some things that you can do. It's really very similar to the out-of-network analysis, in that you should go ahead and do a lot of work studying and understanding the market in which you're in. So you need to know your market, you need to know your network composition, you need to understand your referral positions, and you need to understand the profit margins of your different lines of business. You need to do that work, and if you do so, then you can put together an analysis of what makes sense.
Great, thank you so much for those tips, John. And we'll go ahead and move on to the next question. And the question is, what do you think about outsourcing my revenue cycle management capabilities to a third party?
Great question. It'd probably take me longer to answer that than the time we have. But I'd probably say that if you're going to outsource these functions, I'd probably say the biggest thing that we've realized is just don't check out. Treat your revenue cycle company like a partner, because if you put more into it, frankly, you'll get more out of it.
Great, thank you so much, Richa. And we're going to go ahead and move on with one more final question for today. And this question is, how do I maximize collections?
Well, there are a lot of things that you can do. See, one simple one is that you should make sure that you bill, which I know sounds obvious, but I can't tell you how many times that we're meeting with a provider who tells us that their collections are down, and it turns out that they just stopped billing for some reason or another. So it's simple. If you don't bill, you're not going to get paid. So you should definitely make sure that you are billing.
Well, thank you so much, John, for that final thought there. That is all the time that we have today. I again want to thank John and Richa for their excellent presentation and thank our webinar sponsor, CollectRx. And we hope that you have a great rest of your day and can join us for future webinars.